Thanks, Dominic. I promised Dominic before the session that I wouldn't stand up next to him. That's why I had to find a place to sit down before. So anyways, thank you very much for the invitation. What I'm going to describe to you this afternoon, and hopefully there'll be lots of time for questions, I'm going to be covering a pretty wide topic because I think in the time allotted I wanted to give you a bit of a flavor of as much as possible of what Smart Systems for Health is doing. I'm not going into any great depth on it, and that might be unfortunate if you have some questions, if you want to know more about that. But what I can do is maybe during the question and answer period I can try to get into as much depth as you need. What I was planning on talking about is shown here, is basically spend a few minutes talking about eHealth. And eHealth is something we're starting to hear a lot about these days, and it's a series of strategies and initiatives that deal with helping health through electronic means or through informatics in general. What is the SSH agency? I'll spend a few minutes describing to you what that is. It's now real. It's an agency that was recently created by the Ontario Ministry of Health and Long-Term Care. We're going to talk a little bit about Smart Systems for Health agencies and the eHealth initiatives, what we're calling the eHealth initiatives, and I'll go through those, and hopefully it'll give you a bit of a flavor of what we're doing at the moment. We're going to talk about the Smart Systems for Health products and services. Smart Systems for Health is a company that has just recently been created, and it has, like any other company, a series of products and services that it offers. It's unique because it doesn't charge for its services. In the sense of a typical company, it's a company that operates in the healthcare sector, but offering its services for free. And as one hospital once told me, free, when you say something is free, it just simply means you don't know what it costs. And that's true because these things do cost money, because the hospitals and the healthcare sector, you can't make use of this without it costing you something. And then finally, I wanted to end, and I didn't realize it was going to segue nicely into what Dennis Giokas is going to be talking about next week, or next month rather, with you. He's going to be describing the Infoway vision, the federal government's vision, or the Infoway vision. I shouldn't say the federal government, but the federal organization, Infoway. And they're talking a lot about the electronic health record these days, and we've been working with Infoway a lot in trying to help Infoway understand what Ontario's vision is. And what I'll do is I'll try to describe in a very busy slide, capture for you how we think Smart Systems for Health is enabling the electronic health record in Ontario. And then next month you can check with Dennis to see whether he got it right. And then of course questions. If there are serious questions throughout with a group this size, I think we could probably handle them. So if you have a real serious question, just wave at me and I'll try to pick you out. But at the end we'll have lots of opportunity for discussion. What is eHealth? Start off with a definition. And basically you can read this, but eHealth is the use of information technologies in support of Ontario's health system. So that's how eHealth is being framed in Ontario. And it involves sharing information in a secure, reliable environment, respecting the privacy of the individual. So, and it supports the goal of improving the health status of Ontarians. If you back up a second, and if people, and I'm sure all of you here know fairly well what the healthcare system in Canada looks like. In Ontario in particular, the healthcare system is really several tens of thousands of independent, separate corporations that are all working together or trying to work together in providing better care to Ontarians. So if you think about the healthcare system, many of the people in the public think it's a reasonably well-organized machine that isn't properly funded, and people work fairly well. Sometimes people are surprised that information isn't better shared between hospitals and physicians and so on and so forth in a community. Well, we know that the Ontario's healthcare system, as is true in most parts of Canada, is actually a whole lot of players. And you'll get an idea of the size of it a little later on in my presentation, but it is truly very, very large. It's huge. And the role of eHealth is to try to facilitate communication and collaboration between these various different players, and a great many of them. So that's what and of course the status is to improve the health status of Ontarians. Continuing to back up, some years ago, I'm told, certainly before I was there, a group of people did some studies, and this was based on basically taking a look at the healthcare system from a process, decomposing the healthcare system into all of its various processes. And without getting into the details of that, they decomposed it into 5 components. Basically, this is saying that the healthcare system is composed of 5 distinct set of processes that are groupable. They are health professional knowledge and competency, that dealing with maintaining professional competency, training, education, that part of the healthcare system. Healthcare system management. We call this the jack. It looks a little bit like a jack from when we were younger. Health system management is the management of the healthcare system in general, health promotion and wellness, health research, and then finally healthcare service delivery. Healthcare service delivery is shown here in the center because most of the healthcare system comes through the healthcare delivery system. Now, my background in the healthcare industry, when I looked at this, I said there aren't 5 components, there are probably 3. And if you take traditional health training, health administration training, they'll usually tell you that healthcare, the care system, education, and research typically are the 3. And what they've done here, and quite frankly, and they're right, they've added 2 more, health system management and the health promotion and wellness, which sometimes don't get recognized as part of the formal healthcare systems. After the SARS episodes and so on and so forth, health promotion and wellness, the whole public health system, as we know, is an integral part of the healthcare system, just like hospitals and doctors and so on and so forth. Now, what the Ontario Ehealth Strategy decided to do, which is why that little ring is around the middle, is to focus on health delivery. So basically what they made a conscious decision some years ago to say healthcare service delivery is the highest priority for health. And the reasons for that are, well, the first thing is it's the efficiency. It would affect it. By promoting initiatives in healthcare service delivery, it would improve efficiency for both providers and their patients and their clients. And this priority, when people did this work many years ago, it was done with a whole lot of people from the Ontario Information Technology Association, ITAC they call it, and the various different provider associations in Ontario. And they decided that healthcare service delivery was the greatest priority as opposed to some of the other areas. It will support the health system management. Without good information, you can't really have informed management. So basically they said, well, if you do a good job of e-health reform around healthcare service delivery, it'll provide the information that we need to better manage the system. That was the rationale. And then finally, the information base to support the other dimensions. So essentially what this it said is, we aren't spending nearly enough money and time and energy on all 5 of these components. But what we're going to do is we're going to pick the central one first, and we're going to work on that. It's not saying the other 4 aren't important. It's just from a priority point of view, this is the first one we're going to work on. This boiled down to an e-health strategy, which looks like this. This is not necessarily the way that you see it. If you're in the healthcare system and you've seen this type of presentation before, it doesn't necessarily come out this way. The first 2 points here will come out. The third one doesn't. So I'll talk to them in a little bit more detail. Basically, this is a 2-pronged strategy. What it's saying is, what we're going to do is we're going to put some energy, some time, money, and energy around a series of program reforms. Fairly large, fairly complex, some of them very complex, series of reforms that will help particular parts of the Ontario's healthcare industry. And I'll give you examples of 7 of these that have been approved in a few slides from now. These are called e-health initiatives. And of course, under 1A there, I show establishing a framework for coordination and planning. So there have been created a series of Ehealth Councils. So to help the government, the Ministry of Health, and Smart System for Health make decisions on what's where to go next. So there's an Ehealth Council that's been created for hospitals, for physicians, in partnership with the OMA, the Ontario Medical Association. With hospitals, it's in partnership with the Ontario Hospital Association. There's now a continuing care Ehealth Council. And all this is trying to bring together what we call the silos in healthcare, trying to bring them together so that we can start talking to them about what's important to them. So that's that first 1A bit. The eHealth initiatives are a series of initiatives, and then sector-based initiatives so a variety of initiatives that are trying to deliver applications, eHealth-based applications to the industry. The second part, which is a supporting infrastructure, which is composed of technologies, certain repositories to enable sharing, and standards, are what SSH is all about. So the Smart Systems for Health Agency is about part 2. Some people get confused and think that, because they'll hear a lot about the initiatives with the Ontario Medical Association and so on, and think that these initiatives are in fact part of Smart Systems for Health also. The way it really works is part 1, these initiatives are the customers of Smart Systems for Health. Smart Systems for Health is about part 2. But it's a partnership at the same time, and you'll get an idea. So I'll talk to you a little bit more detail about what the supporting infrastructure is, and hopefully you'll start to understand it. The third part is supporting community-based initiatives is about, and this may become a little bit more obvious, but I wanted to take a little side journey here and just try to put it into context for you. Hopefully this won't be too confusing. It's the first time I've used this chart. The healthcare sector is represented, I've represented it in 3 dimensions along this cube, if you imagine this as a cube. We tend to see the healthcare system along this axis. These are healthcare provider sectors. We tend to think about the healthcare sector as hospitals and physicians and community care access centers, public health units, and the like. And we fund them that way, we manage them that way, we operate them, and so on and so forth in this fashion. And therefore, the health initiatives that you'll see a little later tends to focus on what hospitals need, what doctors need, what community, and so on. So if you think about that for a second, if you computerized, if we enabled a sector to be able to share information or to work better with electronically based information and to collaborate with each other with electronic health records and the like, if we thought of that for a second, what would that do to the average community or to the average patient? Well, it doesn't work very well if the hospital is up here and the physicians in that community are down here and are unable to make use of that technology, if you can understand that. If the labs are able to communicate lab data electronically to physicians, but the physicians don't have access to technology and are unable or unwilling to embrace that, collaboration just falls apart. You can't have one sector ready. So what we've done is there's a second axis, which we call communities of care providers. Most healthcare, you would recognize it as something that's happening locally to you in your context. So if you're in Waterloo, if you live here, if you work here, you probably seek care here. So it's really only important to you as a consumer of healthcare if all of these sectors are ready at the same time in Waterloo. Otherwise, it has no real lasting value to you. It may be good for the hospital, but if the hospital sends you home and the physician can't access the records from his or her office and so on and so forth, it has limited value. So we come up with this second notion of communities of care providers. And a third set of initiatives are starting to be formed around, we're beginning to notice, as Smart Systems is pushing out using sector-based strategies, we're beginning to realize that when we arrive in a region like Niagara, well, Niagara, somebody has to work with the physicians. They may not be on the same train. The labs in the region may not be at the same space. And so someone has to work with them at facilitating the arrival of a state of readiness in a community at about the same time so people can make use of it. Otherwise, so we're beginning to notice that sector-based initiatives by themselves, while useful, are not sufficient to support eHealth. And we're starting to see now a series of initiatives that we're starting to work on, the very early days of the creation of a strategy to start dealing with these regions or communities of healthcare providers. Now, as a concept, this is something that may sound a little academic or whatever we are in a university, but in reality, this is how the healthcare system works. The healthcare system works this way, but in the real world, where it makes a difference to people, it's on a community base. This third axis is one that is more or less well served depending on, it's the knowledge axis. It's a network. It's Cancer Care Ontario, the Cardiac Care Network. It's disease-based or interest-based. If you're a diabetic, there's a domain of information or of knowledge management around diabetes which cuts across these two axes. It has to be meaningful in Waterloo for you. It has to be meaningful in the hospital. It has to be meaningful to the physician that's helping you, and so on and so forth. So that's the breakout. So what we're focusing on mainly today is provider sectors, and what we're seeing in the future is increasingly we're moving into communities of care. The core elements of the strategy that I've just talked to you about are shown here. It's a complex slide, but at the very top you see integrating governance. Here we talk about the ministry, Ehealth Councils, and the agency, the Smart System for Health Agency. So there's a governance structure that's been formulated over this eHealth agenda. And then in each of these sector silos, you might call them, and this is just a representative sampling of them, what we have a series of program reforms. And we can talk to them, and they're silos in a traditional sense. Typically, if you take a look at physicians in general, this is trying to address physician computing or physician e-health initiatives, not necessarily collaborative, although that in the physician space it comes within that. So the first initiative we're working on is an initiative called primary care reform. It's probably the most important initiative from a point of view of the one that will have the greatest impact, we hope. No one knows for sure because we're dealing with physicians. And this stands for the Ontario Family Health Network, which is an agency that was created of government. I don't know if some of you may recall, a couple of years ago, the government committed $150 million to physicians in support of primary care reform. So in effect, the government said, we're going to spend $150 million to help physicians, family physicians specifically, adopt e-health strategies, adopt electronic health records, the increased use of communication technologies, information technologies in their day-to-day work. So we're working with them. This program is run by the Ontario Family Health Network. The OMA is a partner to that. Someone mentioned to me over lunch today that they think sometimes people mention that the OMA is in charge of this. The OMA is a key partner to the ministry and this is unusual. You got to give Ontario credit here of creating a collaborative structure first, because in many other provinces of Canada, these physician associations aren't necessarily very friendly. This is the organization you negotiate with, and so on. If you're government, it's kind of the union of for physicians, and so on and so forth. So to establish a partnership with a group like this is actually quite an undertaking, and it's something that's underway. The work is underway at the moment. We can talk about it a little bit more detail, but we really don't have that much time. Maybe in the questions if you're interested. Lab reform, maybe a word. The objective of this initiative is to try to find a way of helping the physicians adopt electronic health records in their day-to-day life. Okay, so by using clinical management systems of one form or another. A very, very small percentage of physicians in Ontario today and across Canada use computers in the treatment process. Actually work with computers and electronic health records. They all use computers for billing. because the government some years ago forced that. Said if you want to get paid, you're going to have to submit your claims. But that's it. The vast majority of physicians do not do that. And it's a heck of a job for a variety of reasons to try to do that. So the government has committed some money to help them. Lab reform is an initiative that basically is seeking to connect all the laboratories in Ontario, all the commercial labs, there's about 15 of them, I believe, commercial companies, and the 170 plus hospital-based laboratories, to connect them all in a single laboratory network so that lab results, lab data can flow freely to where it's needed, mainly for care purposes to the physicians, to the different providers, health providers that need that information. And that's an initiative that should start to get underway. It is not yet underway. Pharmacies we're working with the pharmacy network. This H&S stands for Health Network Systems of the Ontario Drug Benefits program. So all pharmacies in Ontario are connected to a large network for the purpose of claims adjudication, of claims processing for people who are members of the ODB. So usually it's the aged or people who have programs that are ODB within the ODB. Where Smart Systems for Health is replacing that network at the present time. Hospitals, what's happened was something quite interesting. About a year ago, or 2 years ago, I guess, CHIP, the Canadian Health Infrastructure Program, there was a fund that was created by the federal government, awarded 4 contracts, awarded 4 awards, 4 grants to Ontario-based groups for implementing telehealth care, effectively video conferencing for care purposes in Ontario to 4 different groups of mainly hospitals in Ontario. Smart Systems for Health worked with those 4 hospitals, those 4 groups of hospitals to connect so that all of this infrastructure, this telehealth infrastructure, would be implemented on a common infrastructure so that it could be shareable and so on. So today in Ontario we have I think there's about 85 hospitals now or thereabouts that have telehealth suites. So places in those hospitals in Thunder Bay and North Bay and Timmins and as well in the south in Sudbury and Windsor and so on and so forth. And London has a major center. And these are telehealth suites that are all interoperable using the SSH network. Ontario, I'm told, Ontario now has the largest IP-based telehealth network in the world. So, and this is because there was a network provider willing to come to the table, which was Smart Systems for Health at that time. So this creates a huge capacity, capacity in the hospital sector for collaboration. Now you are connected. So all the hospitals in Ontario are connected one to the other. So now it becomes quite easy to move information. You have a capability for moving information. You no longer have to pay for that highway, that expensive highway between 2 hospitals because it's done already. So this is happening now. And in the community side, as you can see, there's a whole number of initiatives. The C3 initiative is connecting all 43 CCACs, or 43 community care access centers that are coordinating home care and so on and so forth in the province of Ontario. And they're all connected to a common network. And they're all now upgrading their systems, their computer systems in various initiatives so that all CCACs in Ontario will have the same computer system. All home care workers will have access to the same information no matter where you are in the province. Which right now, if any of you know the CCAC field, today that is not the case. And so it's an attempt to raise the bar of readiness for collaboration in the CCAC world. The Integrated System for Children's, ISCUS project, is a project in support of the Healthy Babies, Healthy Children program of the Ministry of Health. So all newborns are registered in this database, and for the first few years of their life they are supported through this system. All 37 public health units in Ontario, and for those of you who know that system, it's a little bit of a challenge. The public health system is managed at a municipal level, so it's the City of Toronto, the regions of Peel, and so on, that are responsible for public health units. And they are all now collaborating on a common platform with a single system. This particular platform was in fact leveraged during the SARS scare of a few weeks ago because when the SARS incident started occurring, there was no capability, there was no fast, effective capability for the public health units to collaborate between themselves because their traditional method of collaboration was faxes and couriers and paper. Well, because we already had a network in place, we already had the infrastructure in place, literally within days we were able to put in an informatics support infrastructure, a server in effect, to support SARS. And now they're moving forward with a bold new program for implementing a proper public health information system. Because the infrastructure was in place for one initiative, another initiative could leverage on top of that. So, and that's the smart system. And then HIV is a project to try to help physicians across Ontario that are involved in the care of AIDS-afflicted patients. What we're trying to do is we're trying to integrate through standards, through communications, and through something called an emergency health record, which I'll talk about in a few more slides. The SSH is about the infrastructure. We're kind of the foundation for all of this. So infrastructure is there, and then registration, unique identifiers, patients, and organizations. So this piece here is what's smart. So this chart sort of tries to bring it all together. I have a few more. Hopefully it'll start to fit. So right now I can appreciate that this is probably a little bit, might be a little bit confusing. It'll start to come together in a few minutes. This is the sort of the marketing slide. Why Smart Systems for Health? Well, Smart Systems aligns with, the government has a broader goal on e-government, and eHealth is just one of the e-government initiatives. And so Smart Systems supports all of these things. And that's what this slide talks to. So there's an e-business context, and eHealth is just simply, our form in the health industry of e-business. Without getting into the details of this, privacy is also a very important part. When people are trying to collaborate, when sectors of the health industry are trying to collaborate, privacy legislation and so on, but the assurance that when I'm communicating with someone down the street that communication remains private is very, very important. So Smart Systems was created to try to enhance as well, not just simply permit people to collaborate electronically, but also to permit them to do so safely. Okay, so what is Smart Systems for Health? As we see, it's a fundamental component of the ministry's Ehealth Strategy. By now, you should know that it's about infrastructure, although, as you see a little bit later on, it drifts into some softer areas of infrastructure. It is a publicly funded, which basically means that Smart Systems for Health gets its budget in much the same way that the hospitals are funded in this province and so on. So Smart Systems for Health, the funds to go into Smart Systems for Health are given to us by government. We apply for our budget. We go through the budgeting exercise the same way hospitals do, other publicly funded organizations do. It's a multifaceted project operating obviously in a very complex environment. And it's providing the secure telecommunications infrastructure for the healthcare system. Smart Systems for Health does not charge for its services. I mentioned that a little while ago. It is an investment that the Ministry of Health is making in providing this infrastructure to sort of level the playing field and make it easier for organizations and for the healthcare system to collaborate. So the conceptual design, I mentioned this a little while ago, it was a joint undertaking. This was a joint undertaking many years ago of the Ministry, ITAC Ontario, and the OHPA. So this is all of and if I listed them all, there's a list here of about 20 or 30 associations. So, the chiropractors and the this and the that. They're all part of the OHPA. So they got together. There was a period of about 2 years, and what came out of it was a recommendation to government to create Smart Systems for Health. And this is our mandate statement. It's a secure, integrated, province-wide information infrastructure to allow electronic communication among Ontario's health service providers. Some people might argue that this is the build it and they will come model of healthcare reform, and I've heard that. But just remember that there's another series of initiatives that are putting together applications and so on and so forth. So this is a multifaceted strategy. It's an independent agency of the Ministry of Health and Long-Term Care. It is a company. It was enacted by regulation of government in, I believe, January of this year only. So it's only been in existence formally since January of this year. So it's a separate company. It has its own bank accounts. It operates independently of the ministry. It has its own board of directors. It's a board of directors. I believe David Johnson, the president of this university, is a member of our board, as an example. So an attempt was made to select board members that represent the interests of the public. So it's a public interest board as opposed to a representative board. So there was no attempt here to say we need so many doctors, so many the hospitals need to be represented, the nurses need to be represented, or whatever. It was an attempt to create a matrix that represents the interest of the public in Ontario. And it is an independent agency. It's an arm's length agency of the Ministry of Health and Long-Term Care. This is fairly unique. I don't think that there's any other province other than Saskatchewan in Canada that is using this kind of model. And the reason for the independent model is because the healthcare system, it was felt the healthcare system needs a trusted third party, someone who is relatively, who can be trusted. They told us we don't trust government. We don't trust each other. My God, if I'm a doctor, I don't like the hospital. If I'm a hospital, I don't like the other hospital, and so on. But so what's needed is an organization that can facilitate this journey we're going to get on around improving the healthcare system through collaboration and through information technology. And it has to be an organization that has no interests other than to serve us. And that was and that was the rationale. In other provinces, where I'm from in Alberta and other provinces, these entities that have been created, which are all a little bit different one from the other, are departments of the Ministry of Health, and there are limitations to what they can do and how effective they can be. The SSH Products and Services, I'm going to spend a few minutes on this. Now you're going to get down into more the technology. What we're providing is networks, and I'll go through these in a little bit more detail, and I believe copies of the slides are available to you if you want them. I think they'll be on the website. There's a network, so SSHA provides networks. We're like a network provider, like a Bell, if you want to, but I'll contrast that a little bit later. We're not a Bell. Messaging services, which is about email. We're in the process of building an email system that can get used. Doesn't have to get used, but it can get used by all healthcare providers in Ontario. Some providers already are well organized inside of hospitals or whatever, but there's a great number of providers that are not. Directory services, hosting services, security services, and portal services. And I'll talk a little bit about each of those in a few minutes. There's also information management services, and I'll talk about the core data set emergency health record, and then a standards committee for working on a common set of it's technology and data standards. My belief is the more important ones are in the data arena. The technology standards, in many cases, are self-evident. There are others a little less evident, but mostly it's the difficult job here to be done is about data and making sure that we're standardizing that. And Smart Systems has a committee that it has created, which is broadly representative of the whole industry, in doing that. Just important note that these components, this isn't a bunch of technology wonks going in building something. It's the way we've acquired this at Smart Systems for Health is via competitive procurements, first of all, and we're trying to get into partnerships with best-of-breed companies that are good at this. So we're not competing with Bell. We've, in fact, contracted with Bell or with AT&T or with EDS or with IBM or whoever it might be. And so most of what I'm going to show you is, in fact, being provided to us by companies that know how to do this stuff and do it in other places in similar scale. Another quick slice at the eHealth initiatives. These are the 6 eHealth initiatives. In fact, there are more than that. I mentioned the EPP, the ePhysicians Project, which is affecting physicians' offices and hospitals. The Ontario Laboratory Information System, OLIS, which is affecting labs. ISCIS, which is affecting all public health units. The Health Network System, which is affecting pharmacies, both commercial pharmacies and hospital-based pharmacies eventually. Today, they're not involving hospital-based pharmacies. The HIV Information Infrastructure Project, HIP, which is these groups. Point of service verification, this is a new project which is being proposed, which is affecting physicians. It's a new initiative of the Ministry of Health. And then telehealth care, which is hospitals, clinics, and physicians' offices, which I described to you as the telehealth video conferencing type of service. It's more than just video conferencing, but for people who aren't necessarily aware, video conferencing is the easiest thing to hang your hat on. There's another project that's just recently been added. It was just recently added. In fact, I just saw the regulation change today that permits us to do this work, and that's in the public health information systems arena. As a result of the SARS, a lot of effort is now being placed upon proper management of our public health system, and that has now is coming forward, and that'll be a major activity for smart systems in the coming months. Just to give you an idea of volume, we expect that there are going to be about 151,000 people as subscribers of one form or another to Smart Systems for Health in the healthcare system. These people work on around 25,000 sites. So the healthcare system in Ontario actually is, we rounded down to 150,000 people in 24,000 sites. I think there are more people and possibly fewer sites, is my own assessment, because no one really knows where these places are. Okay. And it gives you a bit of an idea of the scale of this. If you were trying to get these 150,000 people to collaborate on 24,000 sites, it gives you a bit of an idea. So imagine the network that Smart Systems is going to be having will connect eventually 24,000 sites in Ontario. There aren't networks that I'm aware of in the healthcare system that are larger. So it's a daunting task. It's very, very large. This is our network. It's a managed network. It's IP traffic only for the technical people among you. I'm assuming most of you know what this means. There are 3 managed gateways. And we mean managed because all traffic, all communications traffic is forced to go through these 3 gateways if it leaves the cloud. Imagine the cloud, and if it wants to go into another cloud, it has to pass through these gateways. And that's the government network. So GoNet, the Government of Ontario network, this is not a network that's part of the government network. This is a health-specific network connected with the government network, so that doctors can still do their claims processing. They can still, hospitals can still send their monthly reports, and everybody else that needs to do business with the government. There's about 35 different services that the government requires the health sector to access. Managed gateway to the internet. So what we're doing here is we're saying that if a hospital or a doctor connects with Smart Systems for Health, they automatically get an internet access. In fact, we would prefer if their only way of accessing the internet was through the Smart Systems network, and that's for security reasons. Because we put intrusion detection and all sorts of virus checkers and so on and so forth at the gateway. You can't secure the entire network, but you can try to secure. Now, we realize that that's not going to be possible all the time. Hospitals are connected to universities and so on and so forth. Hospitals are part of communities that are larger than health. But if we can minimize the job, we believe we can enhance the security, the overall integrity of the network. And then finally to the private sector. A managed gateway to the private sector. This is not a private sector network, but the private sector is integrally a part of the healthcare system. So if a company is offering transcription services to a hospital, we're not going to say to that hospital, you can't connect with your provider. So we need to have a gateway to the private sector. The components of this are a large wide area network. It's MPLS based. If you need to know what that means, it's fairly new technology. It stands for multiple protocol labeling system, multi-protocol labeling system network. So it's a fairly new network. And an extended wide area network, which is going to be like a DSL offering, mainly for doctors. But DSL isn't available everywhere, as we all know. So it's going to have to be cable where you can get it. It's going to have to be whatever, satellite, and so on and so forth. And then remote access is for dial-in and that sort of stuff. So status of that right now, the CCACs and PHUs are 100% complete. So we have all CCACs and PHUs to the main offices are on the network. Hospitals are about 80% done in Ontario. There's about 80 hospital corporations on about 250 sites across Ontario, and about 80% of those roughly are done. And physicians are just starting. There's about 14,000 or 15,000 physician sites in Ontario, as far as we can tell, and we're just getting started with them. And sometime this fall, we hope that the volumes will start to grow. And of course, that's a function of the ePhysicians project. It's really a matter of when these projects come together that we roll them out. These other projects were a little bit ahead of the ePhysician project. Secure messaging is about email. And the network, just a final point, the network is going to be provided eventually by most companies in Ontario that are providing networks today. So this is the Bells, the Sprints, the Hydro ones, etc. Secure messaging is an email system. It's a very large email system. We're calling it secure messaging because it will be secure. It'll be much more secure than a Hotmail or that any other type of thing. So it's mail, it's directories. So it's the white pages, so if you want to communicate with someone in the healthcare system, you would be able to find them. It's gateways. Gateways are a means of hooking up. I'll use an example of a lab system. So a lab system might be hooked up to the email system so that a lab could blast out lab results to physicians anywhere in Ontario just simply by putting a lab result in an email and then firing it off using an email delivery mechanism. So a gateway is a way of linking up legacy applications to that. And a variety of collaboration tools, which are things like, not unified messaging, but collaboration tools would be like instant messaging and that sort of thing. An evaluation project. We're planning on evaluating three technologies, remote, it's not obvious, mobility, not remote, but mobility, fax, and unified messaging. These three technologies, it's not obvious that you can do them securely, like safely, without a lot of technology. So we're not using those three technologies yet. We'll be evaluating them sometime next year. The status of that is that very soon, a couple of months from now, August, September, the secure messaging infrastructure will be rolled out. Gateways will be sometime later in 2004. So that will start to actually have real live email customers. So if you think about this, email is an easy way to get people to collaborate between themselves. But not everybody has an email system, and it's Hotmail, and it's very insecure, and so on and so forth. So this will provide a means for people to collaborate. Hosting is, if any of you have ever seen data centers where computers are housing clinical information as they're used in the healthcare system today, you would be appalled. Typically, they're rooms in the bowels of hospitals. If you're in a hospital, it's typically, we don't do a very good job of that because we don't know, perhaps we don't know how to do it. For sure, we're not funded to do it. The money just isn't there. If we're going to be moving to electronic health records that are ubiquitous, and when Dennis comes and talks to you next month, you might ask him that question, like, how in the world are you going to create if it's going to be highly reliable, it had better be safely housed. It better be in these rock-solid data centers. Well, what we've done is we've acquired redundant data centers, 2 data center facilities. They're about 60 kilometers apart from each other, hooked up by a very high-speed network with very, very high availability core infrastructure with restricted access, security, and all the technical and support functions. Basically, what we're doing there is we're saying if something is going to be highly available, we'd better put it in a absolute bulletproof type of environment that banks would use. Like if you're going to rely on an electronic health record, you'd better, it would be good if we use at least the standard we use for our money for healthcare information. Those components are now in place. They're going to be available in August, rather. They're being built. They're ready now, but they're going to be turned on or launched. First one will be in August, and the second one will be in September, just a month later. These facilities, this is a raised floor space. That's all it is, nothing sexy, but very, very highly available space with all the generators and all of the technology required to keep them up and running in any disaster. The fact that there are 2 data centers, it means if one of them goes down, think of 9/11, One of them goes down, the other one's available, and it's available in real time. And so a very high availability application would not be impacted by this type of environment. These systems are, this floor is available for anybody who wants to use it. Security services is public key. It is a public key infrastructure for the healthcare system. SSH will become a CA, a certification authority, and will be issuing digital certificates to the healthcare industry. SSH intends on cross-certifying with GoPKI, the government PKI agency, and so that certificates can be interchanged with them. And then as well, we provide the normal security perimeters and security and best practices that you would see in security. So a very highly secure environment. So with PKI, I can now send a message to you and be absolutely certain, as long as I had your address right, that only you can read it. And you can send me a message, and you can be sure that only I can read it, even if it went astray, unless somebody broke in and somehow got my key. You wouldn't have been able to. Nobody would be able to read it. So that'll start to roll out as well later this year. Portal is in two pieces. A portal is. We all know what a portal is. You think of Excite, think of MSN.com, and so on. So it's a single place that you can go to have access to all of your resources. But it's more than that. You can get single sign-on. You can get all sorts of added features. The SSH responsibility is to provide a core baseline portal, followed by, and the idea there is a portal is not really useful unless it's in a user community, unless it's used by a community. So the first client that will actually use the portal will be the Physicians of Ontario. The ePhysicians project has as its one of its objectives is to build an ePhysicians portal. SSH is putting the infrastructure in place. So the infrastructure is the computers and the stuff that's the base, the foundation of any portal. ePhysician project is coming on top of that and is layering the content and the design of a portal and the features and the functionality of the portal. And so all physicians should have access with a private sector partner that's going to be selected very shortly. So that'll be available in the fall of this year sometime. It may delay a month or two, but the idea there is that every physician in Ontario could have access to a portal, so that if we needed to communicate with the physician community, you'd be able to have access to their service. So it's felt, and messaging would be part of that. So it's felt to be an easy way or a simple way of trying to bring physicians into a program, giving them value slowly but surely, and eventually, hopefully, being able to get physicians engaged in a meaningful way. The emergency health record is a voluntary program to provide critical health and provider information. The idea here is what was proposed was if we had the ability to have an electronic health record that only contained critical information for people who wanted to put their information someplace, so that if ever they showed up in an emergency room, that data would be available for whatever reason. In our consultation with physicians and with many other people, it was felt that this would be a fairly, easy in the sense of there was a high buy-in on the community that something like this would save lives. The bottom line, it would save lives almost immediately. And because you're focusing on emergency care and it's voluntary, you can avoid many of the issues that other jurisdictions have gotten into when they're trying to force the use of electronic records. We all think about, a government maintaining a big record on our, that stuff just doesn't, that dog don't hunt, as they say in southern Alberta. What Smart Systems for Health has been asked to do is to create this voluntary repository for emergency purposes, voluntary. So citizens of Ontario that don't want to play, don't have to play. People don't feel they have the need for it, don't need to. But if you feel that this is important to you or your family, that you would register, and physicians and hospitals would move information, a subset of information, to a common record that would then be available to everyone. So this is an application being acquired by Smart Systems for Health. We would operate it, and it would be integrated with the ePhysicians project in their project so that physicians would have easy access to this resource. So that's what it's all about. Standards, I mentioned it a while ago. It's an advisory committee to recommend informatics standards for the province, composed of 15 organizations, and it reports directly to the minister. The Minister of Health is the one that approves these standards, and it has a very, very broad representation. So this journey, it's a beginning of a journey on the standards front. Standards are very, very long in coming, and standards bodies are notoriously slow. And you have to get started somewhere because there's a lot of consensus building that needs to take place, mainly in the area of data standards. So how does this all fit together? Well, if you think about this, there's the cloud, the SSH cloud. We have security, a security perimeter, and a hosting, which is a room or a series of rooms. And in the room, we put some applications. And then we permit a physician, for example, from their office is able to access an application, which could be their electronic health record, through this. Now, we have a project in Chatham, Kent, in fact, that many of you may have read about. Certainly last year there was a Globe and Mail article on this, and there have been several other articles in the local media about this, and there's actually a project underway where we're testing this with 7 physicians in the Chatham, Kent area, and this is exactly what it looks like. Their application that is actually in the secure data center, and they're accessing it over the Smart Systems network. The physician can also access the internet or can access GoNet, the Government of Ontario network, for billing purposes or otherwise, through a single connection. This is not rocket science. It doesn't sound very complicated, but believe me, when you look at the way some of this happens today through various dial-ups and through various, it's not the way you and I would run a company, but it's the way the healthcare system works. The doctor can then move over to the hospital, and obviously because now he's in the hospital, he can still get access to his data because the hospital has connectivity as well, or from home. So when they go home, they go through the internet, and from the internet they can access through the security perimeter and get access to their application. So that's what it looks like. Then we add in directory and messaging services, and we add in any number of other applications that might be interesting. Now I got one more slide to go, and then we'll open it up for questions. And this is sort of, I'm rolling out this particular slide for the first time. How does Smart Systems for Health enable the development of electronic health records in Ontario? When you listen to Dennis's talk next month, some of you who are here, you'll see a series of options that Infoway is for architectural options for how Infoway believes EHRSs, they call them, can be implemented across Canada. In our discussions with Infoway, what we've been showing Infoway is, and so the next chart is designed a little bit to, in the format that Infoway uses, to try to engage Infoway in a discussion that says, here's the way Ontario would like to do it. Now, it's a little complex. And if you follow basically the principle is that there isn't one single electronic health record in Ontario. This may be a real shock to people, but there are literally thousands of them. And there will remain thousands of them. Nobody is going to force doctors to give up their records. Nobody is going to tell hospitals they have to put their records in a central place, and so on and so forth. So, surprise, surprise, there are going to be thousands of them. We feel it would be much more useful to collaborate among these disparate records than it would be to try to put them all in a central, big, large repository someplace, which would be a non-starter in many cases. So that's the principle of, so if you take a look at this sharing repository, I think the battery is going on this thing. If you, I'll try to point with this. If you look at this sharing repository up here, this sharing column, this is what I talked to you a while about, is about the emergency health record. The emergency health record is in fact composed of 2 components. A health profile, which is a core data set, which is a small set of information about everybody, about the health status of an individual. In it as well is we have selected hospital encounters, which is down here. So hospitals would tell us about key information. Selected CCAC encounters, so home care, people that are under home care, people that are under care by community-based providers of various kinds. information that's important would be stockpiled there. And then a client record for purposes of public health, immunization records come to mind, and others. And then H&S is medication. The medication, there's a very large database with all medications that are ordered and paid for by the government. And that could be made available. And then OLIS, which is the whole lab repository. So a series of provincial shared repositories that would be made available by Smart Systems for Health, that then medical practices, hospitals, CCACs, PHUs, and others, any others, would collaborate with using any one of a number of models. Each of these lines shows, and I'll follow one, and you'll get the idea. A medical practice, a doctor in practice, might use an electronic medical record. So a local record, locally in their office, on a computer in their office, which is what most of them do today when they do it. Or doctors could collaborate regionally, and there's examples of that. I think of Sault Ste. Marie has the group health practice up there, and there's others that have decided that they're going to collaborate on a regional, community-wide basis or whatever. And they could create a repository there. Or they could create a province-wide repository like we did for the Chatham-Kent physicians. And in fact, there's a procurement out to select a vendor to provide what we're calling an ASP-based service, an application service provider for the whole province. Doctors can have the choice of either going manual and not adopting records at all and just collaborating through a browser with the central shared repository, or by using one of these three other means. Now, no one is going to tell doctors what to do. What we're trying to do in the EPP, the E-Physicians Project, is trying to provide physicians with choices that are comfortable to them, that would then they could adopt. And hospitals would follow a similar model as with CCACs. CCACs and PHUs have already decided that they're going to have single application sets for all CCACs, because it makes no sense. They decided for a hospital to discharge patients into community care and have different processes and different systems and so on and so forth. It just makes no sense whatsoever. So they've made those decisions already. So this is, Dennis will talk to you, the Infoway folks are talking about something. Hopefully you'll recognize this concept of being able to have records locally, regionally, or provincially, but put the record anywhere where the health provider is comfortable with it, and then collaborate using the smart systems infrastructure, communicating with each other and sharing through the use of provincial shared repositories.